Do you have any pain in your neck that you feel like you can't get rid of? Or do you have any numbness or tingling going down to your fingers? Today I'm going to show you 4 stretches that you can do to help alleviate your symptoms and to help take pressure off your pinched nerve. Hi, I'm Phil Tam, Doctor of Physical Therapy, and today I'm going to show you 4 stretches for your neck and your arm to help alleviate your pinched nerve. A pinched nerve has many causes. Today we're going to be focusing on one common cause known as cervical radiculopathy. Your cervical spine is composed of 7 vertebrae, and each vertebrae has an intervertebral disc, and a lot of times that can cause herniations or pressure onto your nerve root. That pressure on your nerve root can then lead to numbness or tingling going down to your fingers, which is a very common symptom of a pinched nerve. To help alleviate your symptoms, we often have to find the cause of the compression or irritation of the nerve. And a lot of times that comes from stiffness around the muscles in your neck or down your arms. So these stretches will be good if you're feeling any pain in the neck or any numbness or tingling going down to the arms, or even if you're sitting at a desk for too long and you feel like your head is in that forward position. These stretches will help alleviate some of the tension in there and to help reset that neck position for you. But if you're still feeling these symptoms or you feel like they're getting worse, definitely seek medical attention so you can find the definite cause of your symptoms. So this first one is known as a chin tuck. It's going to be a very simple movement, but it's going to be really important because it helps to strengthen your muscles in the front, known as your deep cervical muscles, and it helps to stretch out your back neck muscles, and it helps to take off compression off the nerve root. John's gonna stand nice and straight, keep the shoulder blades down and back in that good position. He can keep his eyes facing forward. And for this movement, he's just gonna bring his head back, tuck in that chin. I like to think about if someone's trying to give you a kiss and you don't want that kiss, you just kind of lean back in that position. You're gonna hold there for 3 seconds, get that muscle worked out and feel that stretch in the back. Slowly come out of that position and then go back into that. For this, I like to go for 10 to 12 reps. Hold for 3 seconds each time and go for 3 sets of these. So this next one is known as the levator scap stretch. So this one's going to be good because the levator scap attaches to your neck and attaches to your shoulder blade. And a lot of times this is a muscle that gets tight and it can cause that compression that we're talking about earlier. So John's going to stand up nice and straight. He's going to bring his arm up. He's going to look down into his armpit and you're going to use that same arm and grab onto the back of his head and gently pull down. And he's going to have his arm back that way, stretching out this part over here. He's gonna hold for about 20 seconds. For this one, there shouldn't be any pain or pinching in the neck. He should just feel a nice gentle stretch all around this area towards the shoulder blade area. So this stretch is gonna be good if you feel any stiffness in the neck. And again, for any type of cervical radiculopathy, it's gonna help open up that muscle, decrease that tension in the neck, and help open up that joint space for you. Hold for 20 seconds, repeat 3 times, and you should be good. So this next move is known as a median nerve floss. So like we talked about earlier, nerves start at your neck and extend down to the arms. A lot of times the median nerve is a culprit in what you feel with the numbness and tingling. So this movement is going to help stretch out that nerve and get that nerve mobilized. So John is going to start standing nice and tall. He's going to have his arm up like that. He's going to extend that arm out and then have that palm extended like that. You should feel a little bit of stretch in that palm area towards the fingers. He's gonna come back in. And again, this one is just getting that median nerve elongated out as he goes, getting that stretch throughout that nerve root. And then if this feels okay, you can add in a head side bend towards here. That way you just elongate that even further, getting more of that nerve stretch. Come back in. If you feel any intense pins and needles, don't push into that. Go nice and easy. It should just feel like a gentle stretch. And as you do more of this, it should ease up more and more. For this, start off with about 8 to 10 reps. As you get better with it, add in a 3rd set. But again, the point of this is not to aggravate the symptoms. If you feel it getting worse, immediately stop. So this last one is known as a quadruped cat-cow. This one's gonna be good for any neck pain or mid-back pain as well. Again, the point of this is to help restore range of motion to the neck and the mid-back and help that nerve move freely in that joint space. So John's gonna start off on his knees like this. He's gonna sit his hips back onto his heels. And then from there, he's gonna think about rounding out his back, bringing his head down towards the floor, getting all that stretch out to there, and he's gonna go arch his back and extend at the neck. Really try and open all that up. His hips back is gonna help lock out his lower back, so we can just focus on that mid back and his neck area. Again, this is gonna help open up that joint space and let that nerve move freely through that canal. I like to add it in for people who sit at the desk all day. Again, if you're dealing with any type of neck pain or even mid back pain, this is gonna be good to just get that segmental movement through the spine. Go for 10 reps of this for 3 sets. So those are 4 moves that you can do to help alleviate your symptoms of a pinched nerve. Again, the point of these exercises is to help free up that tension in the muscles and to help stretch out that nerve. Again, if you're feeling any of these make the symptoms worse, stop and seek out a physical therapist or a licensed medical professional.